press the bell icon on the YouTube app and never miss another update.
Good afternoon, viewers. I'm Dr. Aseem Sharma from Mumbai, and I welcome you to this first episode of Healthcare Insight. As I told you in the introductory video, we're bringing this forth to you because we want you to understand the inner workings of the healthcare system, the pros, the cons, brought to you absolutely as they are, without any political twists and without any blame game or anything else here. The coronavirus pandemic, it all started in Wuhan in 2019 November with the first index case. Cut to June 2020. In India, we have more than 4 lakh people who are infected with the virus. And Delhi and Mumbai together comprise 25% of the nation's tally. We're badly hit, and there's no doubt about that. We are trying to flatten the curve, but we are far from it as on date. Healthcare systems across the globe have been bled dry. We were not prepared for an outbreak of this magnitude, for a pandemic of this nature, and both human and non-human resources have been limited ever since. India is a developing nation, and our healthcare system is no different. We too are facing a lot of shortage when it comes to resources, both human and non-human, like I mentioned. Before I go into this aspect further, let me tell you about how we are a little different. So in the Indian healthcare system, we have specialities. We have people who are trained in emergency medicine, and we have people who are non-trained in emergency medicine. Apart from the allopathic doctors or the MBBS doctors, we have interns. Apart from these, we have alternative specialities, which are Ayurveda, homeopathy, Siddha, and Unani, which comprise the Ayush alternative medicine system. So in toto, we have a lot of systems who work together to comprise our healthcare system. Now, what has happened with the coronavirus pandemic is that a lot of specialities, a lot of specialists who do post-graduation after their MBBS, we are not trained to do emergency duties. Right after MBBS, some of us have taken a gap of 7 to 8 years before we finally finish our PGs. So for those people, emergency medicine is long forgotten. Now, while there are courses that have been launched by the government and the Ministry of Health and Welfare, Health and Family Welfare, but these courses are mostly online, and a face-to-face course of 7 to 10 days does not really cut it when it comes to managing intensive care. That being said, healthcare workers across the country have stepped their game up. They are at the front line helping out in this situation, which has been called by many journalists as a wartime situation where the healthcare professionals are COVID warriors. All that glory kept aside, I do agree everybody has stepped up, stepped to the front, doing their bit in preventing coronavirus. But this is not a wartime situation, because for war, being an armed forces person, I can tell you that you have heard of the adage, the more you sweat in peace, the less you bleed in war. People are trained as armed forces personnel. We are trained for a wartime situation. We spend so many years training and so many minutes of being mindful as to what would happen if such a situation were to break out. The same cannot be likened or cannot be translated into the healthcare system, because residents, interns, MBBS doctors, they are not trained to handle a pandemic of this magnitude. It's just not in the medical curriculum as such. So disaster management has a set protocol for medical personnel. What has happened is all forms of doctors, be it MBBS doctors, interns, be it specialists who are emergent trained and who are non-emergent trained, everybody has been called to the forefront. And let me take you through the duties which a healthcare professional has to do during COVID. So you can either be put in a screening ward where you see patients and try to ascertain if they have any symptoms for COVID. You have fever wards where patients who have fever of unexplained origin are admitted and detained. You try to look for again any symptomatology and test them if necessary. Then you have quarantine units where people who have come from, who have a recent history of travel or who have been in contact with a COVID positive patient are kept detained, quarantined, and seen if they develop symptoms or not. And finally, you have intensive care units where people who have the severe form of the coronavirus disease, who have respiratory symptoms, who need ventilatory support and intensive care are placed there. So this is what a healthcare professional has to do, one of these duties. Now, there has been a lot of furor and uproar when it comes to healthcare professionals. A lot of people have said that healthcare workers are overreacting, and this is a time where everybody should step up. But we are. Everybody is at the forefront. Everybody is trying to do their bit. Unfortunately, this has to be a thing which is targeted at multiple echelons. You can't just have one healthcare worker defending the whole system. You need political alignment with the same, which fortunately we have. You need administrative care. We need a lot more of personal protective equipment and masks to be given. We are getting them through donations, and healthcare facilities are receiving, huge amount of donations and a lot of masks, but the supply is erratic. We need a more structured and streamlined supply chain for these things. Just one off, if there is a break in the supply chain, it can have devastating effects. Moreover, like I mentioned, the number of ventilators in the city, the number of intensive care units that we have, which can take on such patients. The government has done a great job. We have multiple units all across, at least in Mumbai. I can speak for Mumbai and Delhi because I know about those cities. We have a lot of infrastructural help which is being given from the administrative side, but we still need more. There is a long way to go if we are to flatten the curve or be able to control the spread of this disease and contain the pandemic. Having said that, uh, COVID warriors, as you call them, are at the front line. They are doing their bit. But as a healthcare professional, I think I want to apprise you of something which is very, very disheartening. The nation went through 3 successive lockdown periods, and after that, we had an unlockdown or an opening. That day was devastating to somebody who has lost colleagues to the coronavirus disease, to see throngs of people out in the road taking walks. Yes, with masks on, absolutely agreed, but people clustered together, breaking all possible norms of social distancing, people with their masks off, people out thinking this is the end. It is disheartening. And as a healthcare professional, ladies and gentlemen, I implore you, please do not undermine the hard work that healthcare professionals are putting in. Everybody is doing their bit. This has to be done at multiple echelons. The administration is doing its bit, the government is doing its bit, healthcare professionals are doing its bit, but there is also a personal echelon here. If you do not heed to these things personally, then we will be nowhere. So, ladies and gentlemen, once again, please maintain social distancing. The war is still not over. Please help our healthcare professionals to help you. Stay safe until we meet again for the next episode of Healthcare Insight. This is Dr. Aseem Sharma from Mumbai signing off. Take care.